So, Melrose, I want to start off
Yeah.
first and foremost and just say, firstly, I loved it. And secondly,
Thank you.
what have you made of the Guernsey audience?
Oh, they are amazing. Just, well, the whole of Guernsey. And I haven't got time to see the island. You know, I just think I'd love to stay here a week, but work beckons.
Work beckons,
So
yeah.
I have
and
to get back.
And I mean, that's your work. You want to inspire people to
Yes.
do what you've done in the UK, in the US, there was another location.
Well, they're in Europe. All the
In
schemes are around the world. It's nothing new. It's something so simple. So simple.
Karen,
Some
you
simple
work in
ideas.
health.
Yeah.
Can we make it happen?
I
Can we
think
make it
so.
happen?
I think we have to be courageous.
Yeah.
And I managed to have lunch with Melrose, so we've been having a discussion
Yeah.
about a project that we've already got going in Guernsey in one of our extra care schemes. And we haven't got as far as the work that Melrose has been achieved in the place in the UK, but we're starting to think about how do we improve and help older people to have meaning and purpose, and by doing that help them to improve their own health and well-being, and then therefore that means that we have less cost to our health services. So it's trying to join
That
the
virtuous circle that Alan
trying to join
Williams
the
was just
circle.
talking about. Where's this? I've
Yeah.
not seen it. I need to get a camera in there and film it. Where
Yeah.
is it?
That's Le Grand Cortile, so we're working with Lottie and some artists from Arts for Health, and we've asked the artists to go in and ask the questions that sometimes it's more difficult for us in health to ask. So we're asking them to ask the simple questions about what's important to you, and from doing that we build a picture of actually proper engagement with the community at that level, so that then we can say, right, how do we then bring the next step? And that might be working with our people in nurseries, and it might be about doing some crazy art project in the scheme, lots of things, but it's about what the people in the scheme want. And I think that's the bit for me. If we can build that community, the extra care schemes are fantastic. The environment is amazing. They're beautiful buildings.
Yeah, brand new.
Brand new buildings, nearly 3 years old actually.
Still look great.
Brand new. But it's the community within them that we need to work on next. And the community and that sense of purpose that a person has, attaching back to that will help improve their health and well-being, as Melrose has shown with the evidence from our
It's
project.
a fundamental need for all of us. You know, what we sometimes lose sight of is that we're going to be in that place in the future.
Yeah.
It's meaningful
We're going to be
for
in that
us.
place for longer. We're living
Yeah.
longer.
But we're tending not to plan. You know, it's so important that we plan. Look ahead. Where am I going to be in the next 20, 30 years? Am I going to be as physically fit? I don't think so. Am
You'll
I
still be running across Guernsey, I thought.
I'm coming back to do Guernsey.
Yes.
It just looks fabulous. But, you know, my children, where will they be? You know, I was talking about increasing globalisation. They'll be working across the world. They're not going to be, I don't necessarily want them to be on my doorstep looking after me. I want to know that we build networks. And this is what this is about,
Yeah.
yes?
Yeah.
It's not necessarily my own family on my doorstep. It's about the community and who's coming to build that network and who am I going to share it with and what have I got to look forward to? And this is why this project was so wonderful. You know,
Who's got to buy in over here now? We've
All
got
of us.
Karen's bought in. Who else has got to buy in?
You know, I think a lot of people have already bought in. I haven't walked more than 100 metres and I have been stopped at least 5 times. That was one. What could we do?
Yeah.
So I think the buy-in, you know, listen to you. You said you watch a programme, you think, oh, goodness.
No, I thought it was brilliant, and I saw they were doing something similar to it in Jersey. They are.
And-
So I'm glad we are too.
And I think people just want to know how. How do we get started? And that's why we're having the
Yeah.
conversation. What sort of things might work? How can we instill this in, you know, people's daily lives? And one of the most important things I would say to Karen is ownership. People have to own it. What is it people want? What is it they want to take forward in their own lives? They don't want to be isolated. They don't want to be depressed. That's number one.
Yeah, absolutely.
Yeah? The children are curious. Teachers are curious. They want children to learn about their world.
At that age,
You know.
you just want to learn to be curious.
And
don't you?
although the scheme we looked at was about 4-year-olds, it doesn't have to be 4-year-olds. It could be different age groups, as long as we maintain the interconnection.
Yeah.
And this is what I'm saying about revolutionising the connection. Every one of us here, who is the oldest person we know that lives alone? We can just ask ourselves that. Do we know if they have a visitor? You know? So it's about, let's make sure nobody gets left out. And I love the dandelion motto. You know, I just think it's, you know,
I think
leaving
it's brilliant what
leaving
they're
no
doing.
one behind. I saw that, I thought, yes.
I think it's brilliant what they're doing here. I mean, Karen, you know, as we said, there is some buy-in already that we've got things
Yeah.
happening over here.
Yeah.
I suppose that's it. That the term that's always used, and we use it on the TV, and it's starting to get on my nerves is the demographic time bomb that
Yeah.
we're living longer. Is Guernsey prepared for that? Are we going the right way? Because things like this are great, but are we putting the things in place to make it so that, as I say, we don't have people lonely, we don't have people depressed?
Actually, I made a comment on Twitter just the other week there about making courageous decisions and making the courageous decisions to invest in our community services. Is what we need to do, and the island is doing that. The island is investing in community services. I know that because I'm the recipient of the investment. So what needs to happen is it's a community response. It's a citizen's response as much as it is an individual response. I came to the Journey to 100 event, and we made a connection through that with Whiteley Village and Chandra McGowan. You might remember Chandra's presentation. I've been to visit Whiteley Village since then, and we've learned a lot from Whiteley, but Whiteley have also learned some things from us. But we've started a connection because you made the comment that it's not necessarily about children and older people. So we are trying to develop a relationship with the people who live in the schemes, and Whiteley are as interested in a connection with us as we are interested in a connection with them. So we're starting a little project around exchanging postcards. Once those postcards happen, then perhaps we'll start with some Skype conversations. So you end up developing pen friends. And that gives somebody something they've got to get up for.
We're in the 21st century, why not?
It's a start, but let's not get away from the fact that the human touch is still very important. I'm all for technology, and I've taught all the people to Skype, and it's been wonderful because they've contacted me when I've been away, and I just think amazing that they've learned to do that, because that's been a real challenge. But visiting and just a hug, is some of the things that the older people were saying. They couldn't tell the last time they were hugged.
I mean, that's one of the things you've got on the supported living is, I know my stepbrother, I'm sure he won't mind me saying, is he lives in the supported living, and he has somebody who, if he's feeling down, can go and speak to and something like that. I mean, that's so important. Absolutely. Now, I'm gonna change piece very quickly, because we had some great speeches before that kind of made me think. And you were in health, Karen. Doctors prescribing food. I heard that and I thought, I'm in. I could already see examples of that. Is that something we could bring to Guernsey?
I think there's
something we're doing.
Yeah, I think there are elements of that. I think last week or 2 weeks ago we had the launch of the Healthy Lifestyle Centre. I have a lot of staff.
Which looks lovely, by the way. It's really good. You can go on an exercise bike.
Yeah, it's an incredible facility, and it's recognised. The states again have recognised that we need to do something to address the issue of people's health. People need to be able to take responsibility for their physical health, which will improve their mental health, or vice versa. But going to a gym is a bit scary and off-putting for some people. And we have really good programs around cardiac rehabilitation. We have a rehabilitation program related to people with cancer. These are the things that we're running through the small Healthy Lifestyle Centre. It was recognised that an investment in improving those facilities would help with people's exercise, and then hopefully then we can develop, and we're working really closely as health, we're working really closely with the staff from Beausejour to try and develop those pathways so that then you continue on an exercise programme. The conversations around food are the same thing. Somebody made a comment earlier that doctors prescribe medication to deal with symptoms, and that is absolutely fundamentally true. We're all part of the problem, and we're all part of the solution, and we have to find a way to bring the two things together.
Went very deep there, Karen.
Yes.
All part of it.
But this prescription, I'm happy with prescription, but let's make it prescription for exercise, prescription for good eating. If we have to medicalise it, which I hate doing.
Actually, giving a holistic program, actually saying, here's a program of exercise, here's a program of food, and here's the meds.
We can support you, because I think sometimes people want to do these things, but again, they haven't got the support network to take them through it and to put them on that first step on the path.
I spoke to Wendy and Alan about it, but I just want to get your opinion. Physical health and mental health, especially for people who are older in our community who may not think they're capable of going out for a run. How interrelated is it, and how does it weigh on people's mental health that you've seen?
What I saw when I went into the home that we were with the children, people's physical health, they dwelled on their physical health when they didn't have a distraction. They would have their walking stick, they would potter down the corridor, because they're all about being self-centered. This is who I am, my painful knees. The children come in,
that's out the window, isn't it? Yeah.
Can you see a different the between mental health and physical health? How the two are joined up? I don't know if you saw Hamish on the program.
Oh, yeah, we liked Hamish.
Oh, this won't work. This is a waste of time.
He was within the first episode. He was a convert. I remember.
But you can see the whole change in that. You saw Linda, and on the lawns outside, they weren't concerned about their walking aids. They were concerned about winning. That mental attitude was just so important.
And I think Hamish was a great example because he I can't remember the child who he formed a bond with, but he formed a bond with one of them. Yeah. And it genuinely seemed to lift him physically, mentally. And that's something, I know Autism Guernsey, they do befrienders for people with autism.
Yeah.
And I'm sure in day-to-day healthcare, it's that relationship between the nurse and the patient, the doctor and the patient. How are you making sure that time is available for people who are, healthcare professionals who are very busy, but obviously, relationships help, especially when they're in for a long time.
And I think that's, with extra care, it's an easier problem to solve because they're all together. There are still boundaries and people can become isolated even within extra care. So we have to, that's the reason that we're doing the project, is to try and break down some of those barriers that people build around themselves as well. About having the confidence to get up and be active, that's a big part of it. I think a bigger worry for me is that people are socially isolated in the community because they are
not in the extra care housing.
Not
people
in
who
extra
are just,
care,
Okay.
So what I'm trying to do with the project group that we've got going at the minute is look at what can we do to disrupt the situation within extra care, to develop different ways of working with people that then we can then employ that solution across the community. But it isn't going to be health. It's not going to be the health workers that do that. It's the community that does that. It's the third sector. It's also about, as you said, about recognising who's the oldest person that I know. When did I last see them knock on the door? This is messages that we've been talking about for 40 years. This is not new stuff. It's about us as a community being citizens in the community, being involved and recognising that we're all.
How are we going to get that buy-in?
I think events like this, actually, I now I'm talking about this to other people and saying you need to come along, you need to get involved, we need to do things differently. Other people are saying the same thing, and I think as an island we have this potential to do an amazing thing, but I think we've just got to all get together and get involved really.
I think the resources, it's manageable. This is the first thing I looked at when I looked at Guernsey, and I looked at, you have a population of less than
63,000.
It's less than Wembley Stadium.
I know.
You can have a message go out.
Yeah.
Everybody, who is the oldest person that you know? And when did you last see them? Do you know who lives in the house that they've never come out?
What do you think the barriers are to people doing this? Is it kind of, do people not, obviously people who are independent, they may be independent for a reason. Maybe they like that independence, I suppose.
I think a big part of the problem is people are worried that they're going to do something wrong.
Yes.
I think people are worried about risk.
Okay.
Yeah.
And I think we've become, the walk a mile, run a mile thing.
The Daily Mile.
The Daily
The
Mile.
Daily Mile. Yeah.
When we were young, you went out, not when you went wrong, because I remember
No.
when you were young. But when I was
was a
young,
pest, I
you went out and you just, you didn't see your parents from morning to night. That world, the world has changed, and I think that risk, that people are worried that they're going to do something wrong, I think that's part of it.
If one or two people do things together, I think doing it in isolation is always a worry sometimes. But if you said, right, we've just started a scheme, the two of you, and you go to somebody's home and you say, this is what we've started, and we're just wondering whether you're interested in joining us or just having that conversation. We just want to tell you about what we're doing, and then you can tell us whether you're interested. Because we have to remember, people have choice.
Yeah.
They may choose to live alone. That is their choice. They are not lonely. They choose to live alone, and there's a big difference. But people do not choose sometimes to be isolated. They want to engage. And I said about finding out what people's social histories are. In the program that I did, lots of those were teachers, they were special needs educationalists, they'd done mountain climbing, they had a specialism, they had a history that they wanted to share with the children. Tap into that, find out who people are and what they do, what they're interested in, get them sharing. The older people loved teaching the younger children about what they did. And the children just lapped it up.
I'm now, my granddad, I've never seen him more animated than when I was, he was always quite, again, sedentary, quite isolated, quite laid back. And when I spoke to him about Roman history and his
gosh.
books. He just came out of a shell,
Lit
and I
up.
suppose that's it. You find
Yeah.
that
Spark.
that spark. I suppose that the one thing I want to catch on, and something that you may not have looked at, is over here. It was something I spoke to Joe Joe and Greg about on an island. Showing vulnerability, saying you're lonely.
Yeah.
You know, on an island, people hear about these things, and then they may feel embarrassed. How do we again get past that in this, this island where people live in each other's pockets almost?
I heard a lovely thing from Karen who said brownies
Yes.
are getting a badge
Yeah.
for inclusion
Yeah.
in their activities.
Yeah.
What a great idea! It's about using community again, using community, so people don't feel that they're somebody's different. They're different. They don't stand out. The brownies, together are doing a job together, or doing something that they are actually finding fun to do. And so it's about don't allow people to feel that they're just one of, that they're the only one, and that they have a problem, or they're a problem to community. It's not about that. It's doing the activities that people think, oh, I could do that. Or you ask the skills that people had. Everybody has a history. Everybody has a history. And the saddest thing is that we don't know about those histories, and we want to tap into it and share it, and the children want to learn about it, and they want to talk about it.
I think right. We've only got 1.5 minutes left. What I want on this stage is we've got somebody from health and somebody who's bringing in a great idea. Shake hands. We're going to see some 4-year-olds in care.
Definitely.
Well, we've already started.
We've already started.
And I've had conversations.
It's a promise,
out
guys.
there.
It's a promise. We've just had it here. Promise on stage. It's going to happen.
Oh gosh.
Thank you very
we will
much,
take it
Karen Leach from Health. Thank you very much for coming, and Dr. Melrose Stewart.
Thank
you for
you.
coming over. How long are
you.
you over in Guernsey for?
Oh, only till tomorrow.
Oh, really?
Yes.
Oh, so you can't run across the island. You're going to come back and run across
Work
the
on
island.
Monday.
Welcome. Well, thank you very much, guys.
Okay.
Can we give them a big round of applause for sitting up here, and everybody watching everybody in the live stream as well?
Thank you.
Cheers.